Good morning, my name is Dr. B. I'm the founder of RE-DOX Skin Lab, and today's thought of the day is acne and oily skin. What is the connection? What's clear is that acne is strongly associated with oily skin, and there are two ways that can manifest mostly. One, oily skin has a higher likeliness of clogging pores, particularly when it's mixed with dead skin cells. And what happens when pores are clogged is that it creates a perfect environment for certain bacterial or fungal causing species to overgrow within the clogged pore. And so that triggers an inflammatory response. And that inflammatory response can cause swelling and redness. It can be so severe that it can cause scarring. And so that's one approach. And the other is actually more on the surface level, where excess oil that's produced creates a perfect breeding ground for those particular bacterial or fungal species to overgrow. And so the commonalities in both those two ways in which acne can manifest is that one, oily skin is important. It's an important component. And two, that you need to actually have on your skin the certain types of bacteria or fungal species that actually drive the pathology of acne. And having that combination can result in what we call like an acute acne flare. And as always, the question is, what can we do to minimize the effects of acne? In my last video, I might have briefly talked about what causes oily skin. And it has to do with sebaceous glands, the very glands that produce oils. These glands are responsive to hormones called androgens, which males have more of. They include things like testosterone and dihydrotestosterone. But also females produce a little bit of testosterone and dihydrotestosterone as well. And often the levels of those androgens can influence how much oil is made in most individuals. And in some individuals, they just have sebaceous glands that are really hyper-responsive to the production of oil. So in any case, oily skin often is one of the important elements to an acute acne flare, and then the other is actually having the types of bacteria living or fungal species living on your skin. So now that we've got that clear, the question is, what is the strategy that we can employ to address an acute acne flare, to bring that down? And you can break it down into two approaches. The first is to use topical antimicrobial agents, so antibiotics or antifungal creams. And they have their use, but they're more of a short-term strategy. And the other is targeting oil itself. And this is a much more common approach, and there are many ways you can do it. And so one simple strategy is simply just to wash away the oil as it builds up on your skin numerous times. So perhaps in the morning and at night. And this is where cleansers come in. Cleansers, a good cleanser would simply wash away and reduce the levels of oils that build up on your skin. And the idea is that if you wash away oil frequently, it will reduce the bacterial load. So in other words, the acne-causing bacteria or fungus on your skin, those levels are kept at check, are kept at low levels, low enough to not cause any skin inflammation that will manifest as acne. And that's a really simple approach, and it's an accessible approach to most people. And then the other is to actually dial down the oil production at the surface of the skin. And this is where things like retinoids come into place, anti-androgens, and then other types of enzymatic inhibitors. And so least common is these things called anti-androgens. And these are prescription drugs. They're actually drugs that block the activity of testosterone and dihydrotestosterone at the skin level. So you apply them topically, and they act and they block those hormones from interacting with those sebaceous glands. And the result is that those glands simply don't see those androgens anymore, and they can't produce a lot of oil. And so it's a strategy to reduce it. And it's not a strategy that is widely used, perhaps to treat irretractable acne or those acnes that are very severe. But more commonly using things like retinoids, and topical retinoids or orally taken retinoids act in similar ways. In my last video, I talked about the difference, and that when you take retinoids orally, they act at the sebaceous glands to shrink those glands over time and makes the skin less oily. And if you apply them topically, they likely have a similar activity, but perhaps not as effective as taking them orally. And that's a good strategy to reduce the likeliness of an acne flare. And then the final strategy is to use things which are inhibitors of enzymes that drive certain androgens. So I talked about a particular type of androgen called dihydrotestosterone. And this androgen is enzymatically made often at the surface of the skin, but it can be made elsewhere in the body. And we can use topical agents like zinc sulfate and zinc oxide, and also azelaic acid. Those have been shown to be relatively good inhibitors of this enzyme. And so when you apply them topically, they block the activity of this enzyme, and so it reduces the levels of androgens on the skin. And the result is that those sebaceous glands that produce oil don't produce nearly as much oil as before. And the interesting thing is that you could take those topically, and so if you apply them as an ointment, but also there's pretty good evidence that taking zinc sulfate orally is also a pretty good strategy to reduce the incidence of acne by, again, the same mechanism, dialing down the production of oil at the surface of the skin. So, in summary, one of the, I guess, the most commonly used strategies for dealing with acne is simply to somehow regulate the amount of oil that your skin produces, either by washing it away with cleansers, or using anti-androgens, less commonly those that are prescription, or perhaps things like zinc sulfates or zinc oxides or azelaic acids. And those tend to be at higher concentrations, perhaps around, particularly with azelaic acid, you're looking at 2 to 5% as a more effective concentration than lower concentrations. And then also retinoids have their place, and they all act in a very similar way to dial down the production. And often those who have kind of persistent acne benefit from a multi-pronged approach. So using more than one approach, perhaps using a cleanser and then using a retinoid or zinc sulfate or azelaic acid, and they find that a combination works best to manage that. But what's really happening at the surface of the skin is that we're just trying to bring down the bacterial or fungal load to an acceptable level that's not going to cause an inflammatory response. So that's my thought for today, and I hope you all have a great day.